Welcome to today's town hall. My name is Mark Weinstein. I'm your host for this conversation that is going to focus on a very important topic that most Americans are talking about today. We are going to talk about the reopening of the economy. When is the right time to open the economy? There are good people on both sides of the argument. There are people right now protesting at state houses across the country. There are other people who think it's too soon to reopen the economy, to go to businesses and restaurants because of health reasons. So where do you fall on that topic? We're going to dive into that in a moment with my guests. But if you want to be part of this conversation, you can right now you can type in your questions that will come to me, and with time permitting, we will ask as many questions that come to my desk. So speaking of all that, I want to introduce a great panel of guests. Joining me in studio today is Dr. Mark Caleb Smith. He is the director of the Center for Political Studies at Cedarville University. Welcome, Mark. And then joining me from his home in suburban Dayton is the key infectious disease expert in our area, Dr. Zach Jenkins. He is associate professor of pharmacy practice at Cedarville University. It's great to have you in studio, Mark and Zach. Thanks for weighing in on this important conversation. So for starters, I'd like to get a 1 to 2 sentence statement from you guys on what is your bottom line as you look at the reopening of the economy. I'm going to start with Dr. Jenkins.
Sure. So I think it comes down to two different perspectives. One is the perspective of the public, and the other is the perspective of the government. For the public, I think there needs to be clarity of communication and expectations, so that way there's no misunderstanding, as well as a clarity of information that's being shared. From the governmental perspective, we need to continually work to ramp up our ability to test, to isolate, and to do contact tracing while we work towards investigational therapies.
Thank you, Dr. Jenkins. Mark.
Yeah, I think for me, one of the big takeaways is the amount of uncertainty that swirls around this issue. Most of our political leaders, or their governors, presidents, mayors, they don't have the kind of expertise to look at this issue from their own personal experience. They're relying on experts in a way they're just not used to. So most of our leaders have a sense of economics. They have a sense, even at the presidential level, of things like war and peace. Public health is a different matter altogether. And so I think that uncertainty is fueling a lot of what we see now, and it's making it difficult for them to make choices. The other thing I think is variation. What works in Ohio may not work in New York. And when you consume information at a national level, it's difficult sometimes to get those distinctions down. So if you're watching a national news outlet and they show what's happening in Georgia, well, that may not be relevant to what's happening in Ohio. And I think for people, they don't always make those distinctions.
Thank you for those comments. And hopefully from what you've just heard you have gained a greater interest in what we're going to talk about today. We're going to talk about this reopening of the economy from both a political and health perspective. And I want to start from the political side with Dr. Smith. So from that angle, who has the power to either close or open the economy? Is it the federal government, the state government, the local government?
So basically, I want to try to take a whole semester of constitutional law, boil it down into about a minute or two. I don't know, but it's a difficult question. There's an answer, but it's a difficult question. The question is, what kind of government do we have? We have a government of limited power by design. At the federal level, we give the federal government very specific, explicit powers in the Constitution. So if you flip to Article 1, Section 8 of the Constitution, you see a list of powers that Congress has. You see some powers the president's given in Article 2. And so that's where you start with the basic powers. According to the 10th Amendment, other powers that are not explicitly given to the federal government are reserved to the states and to the people. What that means is there's an awful big chunk of power that resides in your state and local governments that has not been given or enumerated to the federal level. We often refer to these as police powers.
Okay.
And it's the power of the local government to take care of public health, public safety, and public welfare. That's why local governments are in charge of police actions. That's why local governments are in charge of education for the most part. And so these kinds of things contact and they impact our life on a regular basis. Public health is obviously one of these. And so when we talk about a pandemic or we talk about a public health crisis, really it's that state and local government where you find your authority to make these kinds of choices. In some ways, this is great, right? Because state and local conditions vary. Just like I said at the beginning, what works in Ohio may not work in New York. We don't want to have one layer that makes all these choices when there's so much variation in a large, complicated country like the United States. At another level, that causes a great deal of frustration because you don't have one standard. What's working even in Cedarville, rural area, a village, may not work in Columbus.
Correct.
And so you're going to see some variability there. And I think people are sort of thirsting for a clear standard, one policy, one plan, and our system isn't designed to really work that way. And if you listen to President Trump, when he talks about these things, he's making recommendations. He really does not have the authority to dictate when the economy opens and what these state and local officials do.
So, and that's an unusual situation for any politician to really bank on the health experts to guide them in the decision-making process.
It is, and it's a tough spot for them to be. Like I said, they don't have a lot of immediate connection to what they're doing. They don't have a lot of expertise. And even we as a country haven't lived through a pandemic like this. Almost all of us have never have.
No.
And so this is a whole new experience for all of us. And I think we need to give just a smidgen of grace to each other as well as to our elected officials,
Right.
because of the uniqueness of the situation.
Thank you for that. So I'm going to go to a viewer's question right out of the gate here. This person says we can and should live as a free society while continuing to learn about this pandemic, and that's in context to, can you address the overreach or the perceived overreach of power within the states and the collateral effects of food supply, chain distribution, etc.? Can you address that, Mark?
I can address parts of it. I don't know enough about the food supply. Zach might know more about the food supply certainly than I would know and how that's functioning.
Okay.
But basically, you could argue, I suppose, that some state and local governments have overreached. But if they've overreached, it's mostly been politically, not constitutionally. That's what people have to start to wrap their fingers around. Constitutionally, state governments have an awful lot of latitude in this situation. Historic Supreme Court case, Jacobson versus Massachusetts, the court allowed the state of Massachusetts to mandate vaccinations, mandatory vaccinations. And so that riles a lot of people, and that seems offensive that a state could actually say you must get this vaccine in order to function in our society. That precedent still stands. Okay. And so constitutionally, I think Governor DeWine and local officials are on pretty firm ground. You could argue politically, however, that they've stepped beyond what their supporters would be willing to let them do. And that's a different question to some extent. How much of a risk are they willing to take politically to make some of these choices when it could eventually cost them their seat?
And we talked about that before we went live, for Governor DeWine, there may not be a big issue because he's near the end of his tenure.
Yeah, he is. And certainly he would want to get reelected, but
Right.
He's already had a long, successful career. He's been a representative. He's been a senator. He's been almost everything you can be in state and federal government. And so for him, this isn't quite the same as a first-term governor, say like in Florida.
Correct.
Who's sort of feeling his way through his job, having a hard time making choices, always worrying about that next election, because for him, this is a career.
Yeah. I want to turn to Dr. Jenkins. Do you have a comment about this whole overreach and the food supply and how it affects the common person?
I do. I think that the challenge is there's a lot of mistrust that's kind of being bred by that, and understandably so. And specifically to the political aspect of it, we have a group of individuals who are essentially kind of advocating that this isn't a big deal, typically, or it is a bit of a problem, but maybe not as big a problem as maybe what it's made out to be. And on the opposite side of the aisle, you have individuals who are basically arguing this is an apocalyptic event. Mm-hmm. And so where that really leaves most people is they're somewhere in the middle going, who do I trust and what do I do? And that makes it very challenging from a public health perspective, from a medical perspective, to try to help manage this crisis to the best of our ability. And I think there are examples around the world where maybe the response has not been the same, and the public's been more willing to cooperate with experts, with health officials on that matter. Speaking specifically to the issues with the food chain supply, I believe what's being referenced are the issues surrounding the meatpacking plants that were kind of shut down because of COVID-19 and some outbreaks that they had there locally. I believe what's been stated so far is we're not really concerned about a widespread famine-like situation quite yet. I know that's kind of been the headline that's been going around in the media. The thought there is more so that maybe the kinds of foods that we have available are not necessarily what we might normally see. Specifically, the meatpacking plant, there's a lot of reprocessed food that was utilized. And so, you might go to a store right now and get a bag full of frozen chicken nuggets with reprocessed chicken. That may be more of a precious commodity compared to like whole chicken and things like that, as an example.
Yeah, do you mind if I follow up
No,
real
go
quick?
ahead.
I think it's an excellent point about how we're so polarized when it comes to this issue. And I think a big part of it is we're used to thinking on political terms in very ideological categories. I'm conservative, I'm more libertarian, I'm progressive, I'm maybe more socialist. And this issue doesn't fit that category. And so we're trying our best as a country to sort of shoehorn it into an ideological category because that's more comfortable for us. And that's why I think you're seeing people start to protest about wearing masks.
Right.
Because they're turning it into an ideological discussion when it really is more of a public health issue that doesn't quite break down on those basic fault lines.
Yeah. And with, we all follow, what's going on in D.C. and with just the approval ratings of our president and of our Congress so low, that just talks about the distrust that we have in our society for our politicians. That just adds to the tension that we face with the pandemic, right?
Yeah, no question. And that distrust isn't happening overnight. It's not happening because of COVID-19. This is a several decade process we're looking at. And, I don't want to get apocalyptic. I think Zach used the right phrase. Some people are viewing this in apocalyptic terms. But to some degree, we're watching the fruits of a long, sustained decline in our view of government and our trust not only in government, but in each other.
Thank you for that. I'm going to go over to a listener, and this is be directed to Mark. Isn't the state government subject to the Constitution, the writer says, having sworn to uphold, especially in regards to the First Amendment? Comments on that?
Yeah, they are beholden to the Constitution, and there are certainly limits on what they can do. They have to provide due process. For example, if you look at the 14th Amendment, they're required to provide due process when they make these kinds of choices. They have to provide the equal protection of the laws, so you can't be discriminatory in how you engage in these kind of restrictions. And they are bound by the Bill of Rights, just like the rest of the government at the federal level is. However, our rights are not absolute. And I understand this gets to be sensitive for people, especially when you talk about particular amendments, but I have a freedom of speech. It's not absolute. My freedom of speech does not allow me to walk into a public school classroom, stand on a desk, and yell obscenities at a teacher.
Correct.
Right? There are limitations on my liberties to some extent. And we can get into a long discussion about what those limitations look like and when they're operative. And so the question here really would come down to, does the government have a compelling interest to limit some of your liberties? And honestly, I think a public health crisis is one of those compelling interests that government could point to say, yeah, we know this goes over the line, but this is the kind of event where we're going to allow the government to infringe on some things that otherwise we would never allow it to.
Yeah, good insight. And I want to encourage and thank the listeners for sending some good questions already. Let me move to Dr. Jenkins. And we talked about this before we went live as well. And this is a question that could take the whole hour. But I want to implore you guys to be succinct, but still give thorough response. And that is this: how can health and political leaders balance their decisions from a short-term public health versus long-term public health perspective? Zach.
That's actually, in my mind, been the penultimate question from the very start of this. Really, when we started to have these initial cases, there was a lot of concern about how serious this was. And at first, it was sort of downplayed, not thought to be very serious. And we were kind of left in the dark and almost chasing our tails because we didn't really know what we were dealing with. As we started to learn more, we've learned about the seriousness of the issue, and so we took some significant action. One of the biggest challenges we've had related to that, though, is we're trying to figure out, well, how long do these actions need to be in place? And so without a doubt, we know that this virus does have some consequences with it. We know there's some deaths associated with it. I think the bigger thing we're starting to see are there are complications from it, like damages to people's lungs, some clotting that we're starting to see in blood, Kawasaki's disease in children, all sorts of oddities we weren't expecting. And that's becoming a big concern. But then what you have to do is you have to weigh that in those number of cases versus the long-term public good. And that directly ties into the economy. So if we have individuals who can't support their family, if we have individuals who are locked inside and possibly start to suffer psychological issues because they're unable to vent frustrations, et cetera, through the ways that they might normally do so, we'll see some long-term public health consequences from that. There's already discussion in the short time that people have been under these stay-at-home orders that we're going to actually see depression, anxiety, et cetera, long-term in these populations, particularly for our younger children as they're growing up. So the ultimate question comes down to how do we balance that equation? And I think people often conflate the idea of discussing opening the economy up with putting value to a person's life with a dollar sign. And I think that's a dangerous thing to do, because it's not just about that. It's thinking about the long-term livelihood of other individuals en masse. So there's not a safe answer to that question other than to go where the evidence leads us. That's probably the best way I could put that, and to build up our capacity to manage the cases that we have as we start to slowly open things back up. I think that's the best path forward.
I'll get to you, Mark, in a second, but I really appreciate, because the idea and the concept of the mental health, because I think that's one issue that is often overlooked in this pandemic. We're worried about, surviving, living, et cetera, or we're worried about, do we have enough money to live, et cetera. But I think the mental health issue is going to probably be the biggest issue that we see long-term in this. And I'm concerned personally for the younger children and how they're dealing with it, because their worlds are rocked like no other world has ever seen before. Mark.
Yeah, it's and I'm certainly no expert on mental health. I want to make that very clear. But you're also looking at a generation of earners who are potentially out of a career, out of a job. And we think that might be short term. But the last time we had an economic event that's comparable to this, maybe 2007, 2008, 2009, the last recession. However, maybe really the Great Depression is the closest economic event we've had to this. That took a decade plus to work its way through our system to the point where we started to see some recovery. And honestly, that's probably due mostly to World War II, more than it was due to other factors that came into play. So we could be looking at a long process of rebuilding even what we've lost over the past 6 to 8 weeks when it comes just to pure economics. What impact does that have on a generation of people who thought they had a stable livelihood? That's been erased, and now they're in a position where they don't know what they're going to do moving forward. It's a serious issue, and we don't really think about it in those terms quite yet because this is so immediate. But let me add one caveat too, and I think I'm trying to make this a bipartisan answer. Our politicians do not do well at long-term planning. It's true whether they're Republican or Democrat, conservative or liberal. Especially at the federal level, they excel right now in short-term political calculations designed to win the next election. And so they're making decisions on both sides of the aisle saying, what do we have to do to maximize our chances to win in November? Along with, what do we do when what's good for the public? Sometimes those two things don't work together. And so we are hopeful that our politicians will act in the best interest of the public when politically they're acting in the best interest of their party or their own self for November's results. And I think that explains a lot of what we're looking at right now. It's paralysis, it's argumentation, it's polarization, it's political theater at some level because we're positioning ourselves for what takes place in November. And I have plenty of arguments about what's happening right now, plenty of criticisms, but I think it's fair to say that our federal government has really failed to create policies that have addressed these sort of short-term economic issues. They've tried to some extent, and I really don't know if they're well equipped to develop long-term planning for the next event or even how to deal with this event right now, because we just haven't shown ourselves able to do that. And there are a whole bunch of reasons why, but that's where we are.
Is there failure to develop plans? Is that as much because they can't or unwilling to look at it from a long-term perspective? And then how much does, I have to believe that faith in Jesus would make a big difference in our government if that was the foundation of where our leaders were coming from. And obviously, that's lacking.
I mean, certainly you would like to see our publicly elected officials across the board have that kind of faith. And you would hope that would inform their political actions and their political decisions. At the same time, a lot of our elected officials claim to be people of faith.
True.
And this is what we're looking at.
True.
So I agree with you, but I'm not positive it would make a big difference at the moment. In some ways you hate to go down this road, but right now we're not constructed to think long-term at the federal level because the Senate is designed to be a long-term thinking body, 6 years terms, forward-thinking, deliberative, and that's become really a creature of short-term politics, just like the House.
Right.
The executive is designed to be a repository of expertise, where you see things like the CDC and other organizations to have the requisite resources they need to study these issues, put plans in place, and hope someone follows through on them. Our executives haven't done a good job at this kind of long-term planning. And so, and again, I'm being very candid here. Part of it's because we haven't elected people who are good at this.
Right.
And that's not just true for our current president. It's true for our previous presidents who aren't always the most experienced. They don't always have a long track record or a sort of a repository of experience they can call on. And this is just kind of where we are. If you want another indicator, you could look at the deficit and the national debt.
Right.
That's another piece of evidence that we just don't do well thinking long term. So I would like to be more hopeful, but I right now we're in a bit of a bind. So
as I'm listening to you say that, I'm seeing Zach from the corner of my eye. He resonated very well with what you were saying. Do you have anything you want to add to what Mark said?
Yeah. So I think it's also important. We kind of have that going in the background as Mark described. But this is also the first time we've dealt with something like this in the modern age. And we've had H1N1 and SARS and some of these other outbreaks, but it has never been a pandemic that's really affected us this way. This really caught us off guard. We weren't expecting this to hit the way that it did. We didn't have our infrastructure actually set up in such a way that we could respond quickly. And it's unlike what we've dealt with before. If you look back to H1N1 and SARS, we didn't really have an issue developing a test for those. We were able to do that very, very rapidly through the execution of our federal government and some of the actions that they took. But if you kind of look at our response in this situation, the infrastructure wasn't really there through no single individual's fault. It just wasn't. So you have that kind of painted on top of the situation that Mark's described. And you can understand how it's really hard to try to balance this idea of short-term public health versus long-term public health.
Yeah, that's a tricky balance, and you guys weighed into great topics there, great results and information. So thank you for that. I want to, even though we could stay there for a lot longer, I want to move on to testing if I could, and I'm going to get Dr. Jenkins's insight. So we hear in the news all the time, primarily from governors. Okay, we're hearing from governors that they don't get enough PPE, they don't get enough testing opportunities, that our testing is woefully inadequate. Whatever it is, I don't even know if it's true or not. How can testing be improved, and what are the key factors in testing, Zach?
Well, there have been a few issues with testing from the very start. One of the issues that we really saw globally as tests were being developed is the ability for them to rule out and rule in infection was very limited. So we had a lot of false negatives, meaning you'd run a test and it would tell someone that they didn't actually have the virus when they actually did. And you'd have false positives that basically said, oh, well, you've got the virus when you had someone that didn't. So that kind of was where we started with some of our testing. When we started to roll things out in the United States, we had a situation where we actually had developed some tests and there were some faults in them. And our entity, the FDA, basically is set up in such a way that they want to produce the most safe and effective product out there. And so they had a lot of safeguards in place, a lot of blockades in their processes that made it very hard to bring some of these tests to market. So that was a major limitation that we had initially. Now, what the FDA has done since then is they've kind of backed off on some of those regulations to open the floodgates and allow a lot of these private entities to produce tests and try to scale them to the degree that we need them in this country. And because we didn't have that testing early, we weren't able to really isolate those cases appropriately. And so we don't know how far the virus actually spread across the country. That's been our biggest challenge from the very start. So now we have to scale these tests in such a way that we can test a much larger group of people. That requires manufacturing, and it requires ensuring that these tests actually work effectively. Then the other question becomes, who should get the test?
Mhm.
So is it the sickest of the sick? Do you reserve it for the people that have the highest risks? Do healthcare workers get it first? What about the person that wants to know if they had it in January? So those are some of the questions that we've been facing as we've been rolling tests out. Now, our testing capacity has increased pretty significantly, and we're working to try to increase the types of tests that are available, as well as how many we can produce, how many tests we can really administer per day. And to that end, what we started to do is to open up a lot of other testing locations. Outside of just like your typical laboratories, you have pharmacies now that are providing these tests where individuals can actually drive through the pharmacy, they can get the test. You have drive-through sites that are really kind of set up by public health departments where you don't even have to get out of your car and risk exposing other people. You drive up, you can get a test right there. So that's improving our ability to have access to the test. Another thing that we have to really work towards, though, is providing the most time effective tests. So one of our limitations right now with tests is they take a while to come back. Some of these things, it could be several hours before you have a result back. And it's challenging because that doesn't always give you the information that you need. So I believe Dr. Birx, who's part of the coronavirus task force with the White House, has made a statement that we need to work towards antigen testing, which is a special kind of testing that actually produces results very, very rapidly and doesn't require you to go to a medical professional and necessarily receive that test. So that's going to be a particularly helpful tool if we're able to develop that, because it'll allow people to kind of be screened if they need to be screened at a moment's notice with very rapid results.
How hopeful are you that we can continue ramping up the testing so that, one, we can calm the fears of people and that we can get true results and end this pandemic? How hopeful are you?
I'm actually very hopeful about where we're at with testing. Certainly, there's a lot of room to grow, but I honestly think, especially if we have the issue of the possibility of a second wave in the fall, we're going to have more than enough testing in place. The issue kind of comes down to the type of test that's available. So there currently is an antibody test, which tells us if you've been exposed to the virus, but it doesn't tell you that you're actively infected. Then there's the PCR test, which tells you that you have the virus. But again, those things take a while. If we're able to make that antigen test available, that could tell you you have the virus, but also the results could be very quick, which would make it much more effective to use in the absence of any kind of treatment, vaccine, et cetera, as we try to reopen the economy.
Okay, so I'll get to Mark in a little bit. I hate to keep you sitting here, but one question popped in my head, Zach, and that is, how important is it to get testing if, like, you were sick in January and you want to see if you got tested? Why is that important to take now?
So that's actually been a big question. The antibody tests, we've started to actually see results that indicate the virus may have actually been back on the shores of the United States in January. And some of the early reported cases on like the West Coast weren't until like towards the end of January, early February. So that tells you that the virus is more widespread. So that's helpful information for us to know, because it tells us how serious this virus is. It helps to inform public health officials what the actual case fatality rate is, how deadly the virus is. It also tells us, it gives us the opportunity to study whether or not immunity is actually conferred if you've been infected. And then the last couple of things to consider, one of the treatments we've been using quite a bit are transfusions of plasma from people that have actually had the virus before. Yeah. And that's shown some success, especially if it's used early. So if someone actually receives that test, the antibody test, we're now able to ask them, would you be willing to donate your blood, your plasma specifically from your blood, so we can help treat people that actively have the virus? So that information all across the board is very, very helpful for us to know in the long term.
So testing at any stage is really important to do. So I would encourage people to get tested if they can. Let's transition to a question that really both of you guys will have a lot of insight on, and it's political and health. So some countries, like South Korea, for example, seem to have done a better job of handling the pandemic than others. What is it about what they did, their response, that made it effective for them? Mark?
I know politically speaking, they were able to develop a pretty coherent plan early in how they were dealing with this. Obviously, they've had some experience, some more recent experience and relevant experience than we have, and they're prepared. So they had that long-term plan in mind. Therefore, when this unrolled, they're ready to sort of hit the ground running. They're also able, from what I can tell, to communicate that message clearly to the people immediately so that there wasn't really much miscommunication or misinformation or a lack of clarity about what the government was trying to accomplish. I think now one of the biggest frustrations people have is it just feels like we're hearing mixed messages, even on a daily basis or even within the same day. You might hear one message from one person, another message from another person. Those things contradict, and so you're sort of left with just by shaking your head. I don't think that was the case in South Korea. I think a lot of their benefits, of course, were technological and scientific, and Zach's obviously well suited to answer those.
Yeah, we'll get into that.
Yeah.
How about you, Zach?
So there are a few things that are a little bit different about South Korea from the United States that I think are kind of important for us to consider. One of which is its relative size to the United States. It's a much smaller country, and their government's a bit more centralized, even though it is a democracy. So it's easier for them to kind of respond. Now, there's some downsides to that too, maybe from our perspective. One thing South Korea did is they did contact tracing, which is where we can actually identify someone who has the virus and look at maybe who they've been exposed to try to limit the spread of the virus as much as possible. So we'd recommend self-quarantine in those situations. That's normal. We've done that with outbreaks forever. One of the challenges that I think we're running into, though, is over in South Korea. What they did is they actually got on everyone's phone and essentially were able to track them using a phone's GPS. Now, people had to download the app to do it, but in South Korea, everyone was being tracked, and that data was being published. So in the United States, obviously, that would be met with a lot of criticism by a lot of individuals because it's thought to maybe impinge on freedom, and there's the fear of all that information being gathered and what could be done with that information. So that wouldn't be quite as easy to implement here. The government here, in contrast, is working on something similar, but you have to opt into. You have to make a decision. I want to make my personal information available to help with this. Outside of that, people are making phone calls and to try to do that contact tracing. So they were able to employ that much more effectively. Testing is actually a very important thing to consider over there as well. So they had previous experience with a lot of other coronaviruses and H1N1, but MERS, which is a type of coronavirus, they actually had some significant issues with. And so there were hundreds of people that were infected. There were hospitals that were being packed. Waiting rooms were actually big places where people were being infected. And so they started to develop a plan after their MERS outbreak to try to contain the virus. So we didn't really have those issues in the United States with testing before. Over there, they did. So they had to develop a plan to try to execute in that situation. So they had that already in place and started to already work towards developing this even before they had their first case on the shores over there. So that's a big, big difference.
Is it too late for the United States to catch up like what South Korea did, for at least maybe for this pandemic, but then be prepared for the next one? Or can we still catch up and make a difference now?
So from a public health perspective, what always happens after any disaster, we do what's called a hot wash, which is where we basically look at all of the good things and all of the bad things that we did in response to whatever disaster we're dealing with. So more recently, we've had hurricanes, and that same principle was employed to look at how was our response, how could we improve that response, where were the holes in the process. The same exact thing is going to happen after this first wave of the coronavirus. So we're going to be looking at that to say, where can we plug these holes so we don't have the same situation again? You know, one example is we had not restocked a lot of our strategic national stockpile with vital supplies that we would need for these things. And that proceeded from the previous administration to the current administration. So this is just something that we kind of had before this pandemic even started. Well, that's a critical hole that we could try to fill if we have issues down the road. So that's one small example. How can we have testing scale more appropriately? How can we respond more nimbly? Those are big questions we'll be asking in the long term. Now, as for if it's too late, I don't think it's too late to develop those things, but the reality is we have the consequences of not necessarily being as prepared as we could have been. And so we've had more cases, and we've had a much harder time trying to contain the virus as a result of it.
Okay. So I watch the news regularly, especially during this. And one thing I see regularly on TV stations news is they show like hot spots in the United States where the pandemic is, and they tell me they're using cell phone technology or GPS. How is that different to what South Korea is doing?
For what I know, that data is gathered by corporations, analyzed, and it just generally deals with travel so that you can figure out how far people are traveling and where they've gone. It's useful, and it certainly gives you some indicator of what's happening. But the kind of thing that we're talking about here would be much different kind of tracking. It would be much more intimate. It would be much more involved at the individual level. If you download the app and you show symptoms, then you're going to be quarantined, and they'll fine you if you get outside of that quarantine area.
Got it.
Americans, I just don't know if we're up to that, right?
No.
I mean, I don't know if we're willing to do that. We're much more, let's say, individualistic. Let's say we're much more protective of certain liberties, and I'm just not sure if Americans would be willing to say, all right, government, go ahead and we'll download the app, and we'll go ahead and abide by whatever kind of restrictions you put in our way. I think the pandemic would have to get much worse in order for people to volunteer or to go along with that.
Yeah, I agree with you because, I see no American being willing to let their self known that way. I mean, for the fact that the reason why we're even talking about reopening the economy is because of Americans who are tired of being at home. They want to work. They want to make money. They want to care for their family, and they're pushing the government to open up. So if the government said we're going to be able to track you and get all stuff, there's no way they're going to do that.
Yeah, I think the only way anything like that could work here is if it's voluntary, like you said, and people have an opt-in ability, but then you have to question, will enough of them opt in to make it worthwhile? Who knows? Can you bring enough sort of, let's say, subtle social pressure on people to sort of encourage them? Or maybe even some businesses might say, if you're not willing to download this app and function this way, then we're not going to let you come back to work.
Right.
So they could enforce it that way, but I don't think the government's going to be in the business of requiring it.
Yeah, I think people will really complain about overreaching if that happened. Yeah. Let's stay politically, Mark. The stay-at-home orders that monitor the close of businesses, is that a constitutional issue?
I mean, to me, it's not necessarily. I mean, certainly there's always a constitutional element. Whenever the government passes a law or makes an order like this, we should always be looking to make sure that it has the power to do it. I think the government has the power to do these things at the state and local level. And that's one of the reasons why you haven't seen a lot of traction in lawsuits against state and local governments so far. Now, those lawsuits are coming as people start to resist and start to, let's say, rebel a little bit against some of those orders. Then you're going to see those things work their way through the judicial system. But I don't see those necessarily as constitutional infringements. Now, if the government begins to get what we might say unreasonable about these, let's say that we've seen a dramatic decline in cases. Let's say that we've seen a dramatic decline in deaths and other factors, and government continues pretty onerous stay-at-home, shelter-in-place orders, then you could argue it's lacking rationality. And there is a constitutional argument to be made there that part of due process is being reasonable and having a reasonable approach to how you interact with your citizens and regulate your citizens. So I think it could be challenged. The governor of Illinois said recently that he wants to prevent churches from meeting for the foreseeable future unless there is a treatment or a vaccine. That's the kind of thing where you're going to see people push back and have a little bit more success, I think, on constitutional grounds. So on the whole, I think government, they've had their powers to do it and they've exercised them. Again, I think most of the argument there would be politically, maybe they've stepped too far, but not necessarily constitutionally.
Okay. So, I mean, there are people across the country who have been arrested for going to church already, right?
Right. They're limited cases.
Right.
And I got to be very careful here. I mean, if the government singles out churches and says we're going to allow other kinds of meetings to occur, but not churches, well, now you have a very strong constitutional argument that your free exercise is being denied. So if we're going to allow athletic events to take place, but not church meetings, for example, you have a much stronger constitutional leg to stand on. But if you're making, and I'm going to use the Supreme Court's language here, a religiously neutral and generally applicable standard or law, then typically that's going to stand up in court. So as long as you're applying the regulation across the board to all groups equally and you're enforcing it equally, then I think the government's going to be on pretty good footing.
Yeah. Zach, I want to move to you. If people across our country are allowed to return to normal, whatever normal means, what are some infection control strategies that should be implemented? Masks, decontamination, staggered shifts, whatever. What are some ways that should be suggested and followed?
So I think the data has really kind of shown that when you start to layer on these different elements of protection, we'll call them almost shields, it sort of ends up greatly reducing the amount of infections that can occur. And we're never going to be able to get that number to zero. That's true with any kind of risk mitigation strategy, even outside of infections. But the less spread we can allow, the more easy it's going to be for us to respond accordingly to try to contain those cases as they occur. So to that end, it's going to be very important that businesses try to set up those 6 feet increments of distance as much as possible. We're going to be encouraging people to practice good cough and sneezing hygiene, where you don't cough or sneeze at someone, but you do it into your shoulder or into the crook of your elbow. We're going to be encouraging people to disinfect commonly used surfaces like doorknobs, like handrails, like keyboards on your desk, things that are going to be real reservoirs for infection. It's going to look a little bit different at every type of facility that we're dealing with. And so some people will be able to operate with staggered shifts. Some employers may allow individuals to work a little bit more remotely. And that's going to be a change that we see. It's going to breed some interesting questions in the long run. People may start asking, well, if I could operate this efficiently remotely, do I need to actually have people physically back in the long term? So those are going to be interesting questions that pop up down the road. But I think all in all, we're going to have to put some of these measures in place until we actually start to develop a better way to handle these cases and to keep our overload of the healthcare system down.
Okay, so I have a 2-part follow-up question to that. So, and I'll put you on the spot. So, are masks and hygiene, proper hygiene, are those really the key solutions to overcoming or avoiding the pandemic? And then, if so or not, let's say if so, is that a long-term sustainable model for us to follow?
I mean, we've known for over 100 years, 200 years plus, that hand hygiene is the number one way to prevent infection. It beats everything else time and time again. And so making sure that we're frequently washing our hands and not touching our face, because this is something that transfers via those respiratory droplets. Those kinds of measures are really going to help limit the spread. So I wouldn't say overcome, but I would definitely say it's going to limit the spread greatly. When we stack that on top of a mask and then another person wearing a mask and then trying to maintain distance between individuals, that's where you see those rates of infection greatly reduce. When we start to remove some of those layers, though, that's when the rates increase. And that becomes our big concern.
Okay.
As far as masks go, we're going to start asking, we're just discussing this today in some of the hearings in Congress with Dr. Fauci. They're talking about, are we going to start looking into what mask materials are the best materials?
Right.
So that's going to be something we're going to be investigating down the road. We're also probably going to be looking at how often we should be washing masks, because if we run into a PPE shortage again, we may not have the availability of masks. So those are big concerns that we have to think about.
Do you think that as a culture in America, we will be wearing masks in a year from now or 2 years from now on a daily basis?
So that's a really good question. If you compare a lot of your Asian countries like South Korea, Taiwan, China, wearing masks over there is pretty commonplace. Actually, if you travel internationally a lot, you'll see that even in airports. And the reason for that is they're known to deal with these viruses frequently, and they also have a lot of air pollution too that they run into. So masks are normal for them. And so culturally, it's more acceptable. In the United States, I think what we're going to see down the road is kind of a smattering. We'll have individuals that'll be very big proponents for it. they'll be wearing masks. There are already people selling designer masks online with fun things. Disney, I think, has put all types of masks out there for characters and stuff down the road. So you'll probably see that. But then you're also going to have a crowd of individuals who feel like it's impinging their rights if they go out and wear a mask, and they don't necessarily buy into the narrative that's out there about the virus. Right. So I think you're going to have a mix of both.
Okay. I want to ask two final questions, and then we'll get to questions from our listeners and watchers, viewers. This is a personal question for both of you guys. So how are you guys personally dealing with the pandemic and the stay-at-home orders? And then are you going to go out to a restaurant on Friday when you are allowed to go out, or to a store?
I'm definitely going to get a haircut. I'll say that. So
good idea.
Tony here in Cedarville is taking appointments. I've made my appointment on Friday. I'll be going to get a haircut. So some things certainly I will be willing to do, but I will not be willing to do other things until I feel a little bit more comfortable about it. And so one of the benefits of living in Cedarville is that we're pretty small, pretty isolated. Once people start to do more traveling and more back and forth, whether it's Beaver Creek, Dayton, Columbus, wherever, you're going to see much more, I think, risk involved to some extent. Now, again, some of that risk is manageable. I understand that. But I'm going to be pretty careful about it. I mean, it's been interesting in a lot of ways. I think it's harder for our children, for my children. It's harder for them, I think, than it is for me. For them, this is difficult, not only physically, it's difficult emotionally. They're disconnected from friends. They're disconnected from their routine. And so I think for them, it's been a lot more difficult for them. I think they've managed it in our household pretty well. But yeah, it's going to be a transition once we get past it. I'll just say one thing. My kids are now on a sleep schedule that are more like college students. So like I have a 9-year-old, she's going to bed closer to like 11 o'clock at night, which is just unheard of. And they sleep a lot later, but this is just kind of the way that it's developed. And I keep telling them, you're going to have to get back on a schedule at some point. And I'm thinking that might be August. Right? Isn't it amazing to think how long this thing has really played out and it's just disrupted?
So you're not going to go out until you feel more comfortable. What are you going to look for that's going to say, okay, I feel comfortable now?
I mean, for me, I want to see more people in masks, honestly. Some places I go, I might be the only person in a mask, which causes me a little bit of concern. It doesn't prevent me always from doing something, but it does cause me a little bit of concern. So I'm looking for businesses that are going to have very clear restrictions and have very clear approaches to this. And I'm going to try to go to those businesses for the most part. I just think, again, I know I'm not always normal, but to me, it's just a question of taking care of each other. Right. You wear a mask, other people wear a mask, then you're both trying to care for each other's needs at that point. So that's how I'm going to approach it.
You probably have a Georgia mask, don't you?
Not yet.
But you will.
It's in the works.
Okay.
It's in the works, yeah.
Zach, what about you?
It's been really interesting on my end. So my wife teaches third grade. So she's been working full time throughout this and trying to figure out how to teach online. Of course, with my position here, and very similar to Mark, we've had to figure out how to teach online from the university. But the other half of my job is actually in the hospital. So I've actually been dealing with these cases on the front lines. I've seen what they look like. I have an ICU that's been full of them. My office is 3 feet away from the ICU at the hospital. Wow. So I pretty much go there. I live and breathe COVID. And then I come home and I live and breathe COVID. And then in the middle, I try to figure out how to read up on all the literature coming out in medicine, as well as the media. And then try to figure out how to manage my 3-year-old and my 8.5-month-year-old. So that's been an interesting experience for us as a family. We've been trying to navigate that. As far as feeling comfortable to return to normal and kind of go back to things once the floodgates open, I think my concern, as far as just going into a restaurant the way we used to, even with some of the safeguards in place, we're going to see a ton of people show up because they've been kind of cramped in close quarters. It's almost going to be like we've been holding the pressure down on a garden hose, and then we let it loose, and it just kind of sprays all over the place. It's the same deal. I think we're going to see with restaurants, with salons, with normal retail stores. So I'm probably going to bide my time a little bit, and then I'm also going to watch for things in a very similar way, like Mark said, where I'm going to be looking for places to try to employ a lot of these really smart strategies, because I worry about some of the odd things that we're starting to see in children, like with Kawasaki's disease. I worry about the possibility of me exposing some of my loved ones that are older to the virus. So I have to be very careful about that.
Yeah, thank you for that. time for one last question. It's a political question. I couldn't let the town hall go by without asking you, what kind of impact is COVID-19 playing on the 2020 presidential election?
Well, in some ways, we don't know, right? This is all still unfolding. November is a long time away when it comes to politics, and it's not always going to be clear how it's going to play out. Typically, you'd expect President Trump to be in a very strong position for re-election as an incumbent. Before this, the economy had been doing well, unemployment was low, other economic indicators were going well from his perspective. So I'd have certainly bet that he was a favorite to win re-election in November. Now this is all sort of throws everything into a blender, and it's difficult to say what's going to come out of it. I do think that you're seeing his public opinion ratings decline a little bit. I think that's he should be worried about that. He also, though, may have the benefit of running against a Democrat who maybe isn't the most formidable opponent. And so in the binary sense, he may be lucky enough to draw two pretty flawed opponents in his two presidential elections. It's having an impact, and as I said before, I think it's having an impact on decisions that are made at some level. Now, I want to be careful. I mean, at some point, you want our public officials to make decisions based on politics, right? We have an accountability system built where if they don't care what we think, then they're disconnected from us. You know, we don't want them making decisions completely apart from public opinion. And so having a political element injected into it isn't always bad. It's only a concern when that political element seems to drive decisions to the expense of other factors. So if you think they're making choices in order to guarantee their own election as opposed to the public good, well, that's obviously a huge issue. I'm not at the point where I'd say that's a descriptor of President Trump necessarily,
Right.
but I think we should always have our radar up in that kind of situation. So it's there. There's a bias there certainly for that, and that isn't always bad.
Right. It's going to be an interesting run to November because, you know, the conventions. Who knows what's going to happen there? Really,
Right.
the rallies that has always been President Trump's trump card,
Yep.
so to speak.
That's right.
Are gone. So they have to do a new way of campaigning, and it'll be interesting to see how this all unfolds. So thank you for your political expertise. Let's go to the questions from the viewers. One, Zach, does staying in a quarantine environment weaken our immune system?
Well, that's a great question. I would actually say I think it depends on if you're living in a clean room or not.
Okay.
So if you're in an environment that doesn't have any kind of pathogens, then likely you would be really concerned about the possibility of being more infected. I know there have been a lot of concerns that maybe not getting out in public, and I think this has been expressed in social media, may put people at a higher risk of infection, not necessarily from COVID, but from other infections. And I think there is some truth to that. I don't think it's going to hit quite as rapidly as is being implied, because we aren't living in necessarily clean room environments where there aren't any kind of other germs or anything like that floating around. So I think that's kind of important to recognize, but it is definitely something that we have to think about in the long term. Certainly, if you're going out in public to the store and you're touching surfaces, et cetera, you're being exposed to different microorganisms.
Okay. Another question comes, and this is probably for Zach as well. Are we seeing any difference in pandemic levels between lockdown versus no lockdown?
So that's a great question. I think a lot of it comes down to the types of models and kind of our trustworthiness, or the trustworthiness of those models. The reality is we've been trying to revise those things since the start because we didn't have a complete data set. And we know that some of the initial reports were indicating we're going to have over 2 million deaths in the United States. Now we're seeing it's probably going to be far less. Part of the issue there is we don't know how widespread the virus was, and we also don't know how deadly it is. And so those things are kind of hard to measure without all that testing that we need. Certainly, we can say that we are starting to see the deaths level out in places. We're seeing the actual curve of total infections flatten out. And that's not just within the United States, that's in other countries that have had those lockdown measures in place. So I think we're seeing the effect, but it's going to be one of those things we can't say how much of an effect we had absolutely until after we're past the point where we have all the information.
Okay. This question was directed to Dr. Jenkins, but who knows? Maybe Mark can answer it too. I don't know. It says, are you concerned about the seemingly recent uptick in conspiracy theories and misinformation that masks are dangerous?
I am very concerned about a lot of the information going around on social media. And I'll also clarify this. I don't think we should censor all of that. That's my personal opinion on that. And I'll share why. I think when we censor all of that, it sometimes sends the wrong message to people that are looking for a reason to believe something. So if we need to educate people about the right way to approach something, we can't silence them. We need to continue to be consistent with what we're saying. So I'm concerned about the mask issue because we know that it helps prevent you infecting other people. That's the bottom line. And if you're taking care of the mask the right way and you're washing it the way you should, you're wearing it the way you should, the ability for it to infect you is going to be relatively minimal in the grand scheme of things. So misinformation without it is a big concern for me.
Yeah, I just real quickly weigh in, not on the scientific part of that question, but one of the reasons that conspiracy theories are attractive during times like this is because they provide certainty to a very difficult and uncertain situation. And so if you can put the right theory in front of someone that connects a whole bunch of dots in their mind, then it brings them some level of assurance and comfort because they can explain reality. That doesn't make it true. In other words, it may make me feel better, but it doesn't make it true. And so I think that it's a problem, particularly right now, because people are wrestling with what's happening, why is it happening, how can I explain it? A lot of these things we really can't explain because these pieces of information aren't necessarily related to each other. Yeah. And sometimes we just have to live with that.
Okay. And I'll add a couple of thoughts to Mark's point. So I would challenge people that see things going around on social media to not necessarily dox individuals that are sharing that, but instead to try to look at what's being said and who's saying it. So the most recent example is the pandemic video, which was what was just referenced. And if you dig into the individuals, the credibility of the person talking about things, you'll find out that individual has not really had a very high reputation for the past 20 years. And there are a lot of reasons for it, one of which is theft, among other things. So it's important not only that we question things, I think we should continue to question information that is shared to us, but also that we're equally questioning of the individuals that are sharing that information. There's a great logical idiom I think you can apply in this situation, and it goes like this. It's basically don't attribute to malice what can be attributed to stupidity. A better way to say that, a nicer way to say that is, there's a lot of information out there, but there's also a lot of human error. So be careful to always assume the bad of someone when it could just be human error and good intentions.
We have maybe about a minute left. Regarding the opening of the economy, why aren't some states doing so regionally or in different sectors?
Well, if they're going to do it regionally or in different sectors, they're going to have to coordinate that. That isn't always going to be feasible in doing for a host of not only political reasons, but institutional reasons as well. And even, like Ohio has a pretty close relationship when they've had these discussions with Kentucky, with Indiana, with other states that are similarly situated. But even when you look at rates, you see very different outcomes in those, even within those states themselves. And so I'm not sure it's in the best interest of a state to think we're going to open up with a whole region of the country if part of that region is doing, say, much worse than a place like Ohio. So I'm just not sure it's for the best.
Okay.
And I'll add to that. I think there's also something that Mark alluded to earlier, in that we have so many different environments across this country. We've distributed our power in such a way for a reason, and is to provide minority representation. Yep. And really, when you look at states, they're all in different shapes, and they all have different situations that they've dealt with based on how the virus was handled initially. And so we have to be careful to just adopt what everyone else is doing. I think we have to look at things on the smallest scale we can, because that's going to give us the most effective response.
Yep. Okay. Maybe my last question. I'm going to join two of them together. So, Zach, can we really base a reopening on antibody testing if the original diagnostic testing was never actually the diagnostic testing was never factual? Does that make sense?
So the testing was accurate, just not as accurate as we would have liked it to be.
Okay.
Does that make sense?
Mm-hmm.
So basically, I think there's some evidence to suggest that we caught a large number of cases, but certainly we maybe didn't catch as many as we thought we did because the tests weren't perfect. So that's evidence to go off of. But our testing has been improved in such a way where our early ability to rule out infection was about 70% with some of these early tests, but it's about 95% with some of our current tests. So we've gotten a lot better with what we have available. So there's some certainty there. Basing it on antibody testing and looking at prevalence, I would say is probably a little bit more dangerous, just because I know there's a lot of people out there talking about the New York data, the Santa Clara County, California data. The challenge there, though, is those tests have a high positive predictive value. So it means it's telling you that there are probably a lot more people that have had the virus than maybe actually had the virus.
Right.
So I think we have to kind of be careful with some of those tests still. And that's where we have to look at all this data in aggregate.
Okay. And this is the last question, and then we'll wrap it up. This is a good question. I can't let it go without this one. In seeing the COVID numbers in comparison to the flu, what is to stop the government from shutting down the country and destroying small businesses every time there is a possibility of a health crisis, whether it's this magnitude or smaller? This is probably for both you guys.
I mean, politically, people have to always remind themselves ultimate sovereignty in our system resides in the people. And so if we're overly worried about governmental overreach, we can very effectively replace our governors. We can very effectively replace our president. We can move them out of these positions of influence directly. It's just not as quickly sometimes as people might like. And we can hold them responsible if we think they've overstepped their boundaries. And so if we're worried about governmental overreach as sort of this long-term threat, and I think it's a reasonable worry, we have the means at our disposal to address that. So maybe we should quit re-electing 90% of all incumbents who run for re-election, let's say, at the United States Congress. That might be a place to start. And so, I think we have the means within ourselves to make sure this doesn't happen in the future.
Zach, anything?
And I'll add to, I think it's also important to recognize if we kind of assume the best of people in this situation, especially if we're electing the right people, as Mark kind of alluded to, I think there's going to be a lot of hesitancy to take the same types of actions that we took the first time. And that's where analyzing things afterwards and saying, here's what worked, here's what didn't work, here were the consequences of that. That's going to be a very important thing to investigate, because if we discover that we were too extreme in cases, then that's not going to spell for a very good situation if we do this again in the future. So I think there's going to be almost a natural approach to that to some degree.
Good insight, guys. Thanks for an hour of good discussion and answers. I'm sure our viewers enjoyed it too. Thanks for joining us on this town hall, and I invite you back next time for a town hall on a current event topic that our faculty members can address. Thanks for joining us.